Dr. Saalabian, hello, how are you doing?
Fine, thank you very much.
How was your lecture this morning?
I enjoyed it a lot. I was in a very intense body contouring session with Professor Ella Lee from the US, and it was very interesting, to have him as a massive weight loss surgeon and me as somebody who's doing much more I would say petite body contouring, so not that much weight loss surgery, but these modern technologies that we have nowadays.
We'll get into that now. So when we're talking about body contouring, what are we talking about?
Look, body contouring is the most important thing I tell every patient that I consult. I tell them always, it's not a weight loss procedure. Like if you want to lose weight or something, there are better specialists that help you. Body contouring is of people who already maybe lost weight and have sagging skin, or they give birth and the skin envelope is not that good and they want it to be like before, or sometimes even better. Or for patients, they have not the most charming proportions. Some people are from the weight in a normal setting, but they don't have the roundness, or their body doesn't look like they're doing sports and they're active. And these are patients which we can help through our modern techniques to give them the contours that they desire, but to give them the best version out of them that they could be.
Yeah, I mean, because you go into Instagram or whatever and social media and you see people going into the gym, getting pumped, and you say, I want to do that. You do exactly the same thing and you never get the same result.
Yeah,
so that's one of the ways to more or less get the result.
You have to get it, but you have to maintain it. I always tell my patients, it's not the 3-hour surgery that can change your life, but it can be the motivation that you have afterwards, because I have a lot of patients, they do everything and they see slightly results, but not even near to what they want. And maybe the body contouring surgery is something that really pushes them forward and motivates them. And the healthy lifestyle cannot deliver the healthy lifestyle of a surgery, but we can make the people happy to give them the best version of themselves.
Yeah, you can stay like this, but you have to work at it.
Exactly.
It will give you the push.
Exactly.
Yeah. What have been the basic challenges and changes in your field in the last years that you would like to underline?
There are a lot of new techniques coming from South America, from the US. And, with new techniques, there are always something sometimes dangerous, because people are not well trained in everything. So it's very important to be educated, to be specialists, to know the risks of these surgeries, because aesthetic surgery should not be a risky surgery, because we're dealing with healthy patients, and they are not sick when they come to us and want to get healthy. They are healthy, but they want to achieve something, a body goal that they didn't have. And it's always important when we adapt these surgeries or these neuro techniques that we do it really under safe circumstance. That's the most important.
You developed a technique called the 360 lipoabdominoplasty method. Tell us a bit about it.
Yeah, look, in the beginning, most patients were coming to me female patients after giving birth to 2 or 3 children. They were complaining about the skin and the abdomen and the muscles. They were not like before, and we just treated the abdomen. But if you look at the body, a body is not only one dimension. It's like a stature. It has to look good from every corner. So nowadays, my approach is mostly, no matter if I treat the arm, if I treat the leg or the torso, I try to give the 360 look, that the proportions, because the secret is, it's more shape over size. So we try to really give a perfect shape, nice transitions, harmonic figure. So we have to work around it. It's not just these 2 elements or 2 dimensions. And the 360 is one part of it, to work around the human being to give it a really 100% nice result.
In some ways, we could say that you work as a body sculpture of human people.
Yes,
of peoples. So that means you get the person into your consult, into your office, and you say, okay, let's see what we can get out of here. Let's see what we can do. Also take into consideration what the patient wants, what he's asking. No?
Yeah. Nowadays with social media and everything, we don't have an easy job, because before you were just competing with yourself, because you saw yourself in the mirror. You maybe saw one guy or someone that that was very fit, but nowadays there are influencers for everything, for nutrition, for health, for nice bodies, and the expectations get really high, and a serious doctor has to consult you and really listen to you, what you want from him. And he has also to be honest sometimes and tells you, this is something that is not possible in your case, or you don't have the genetics to do these kind of things, or it's not good for your health to do that. But there are many, many patients where we can really help also with our surgeries.
So what you do, in some areas, you get rid of some fats and you resize that area, but in other areas, what you do is add fat.
Exactly.
So you're actually sculpting the body. What's more difficult?
Everything altogether to know how your long-term result will be, because, you know, also when you see it on social media, these intraoperative pictures, you know, in the OR, I never leave the OR. Well, it always looks beautiful when I leave it, but I have to imagine the healing process, everything, the aftercare of the patient. So it's always good when the patient is like based close to you, that he has the aftercare of a specialist and not somewhere else, because all these steps are important to maintain these really good results that you try to deliver during the surgery. But yes, we are some kind of sculptors, definitely. But like the human being is not like a piece of wood, so not everything is possible. And you always have to examine someone and really see what is his body type, what can I give this person. And like trends to look like someone else or something else, these trends are never really good, and they're also not good for the patients. But to look beautiful, to have nice proportions is something that everybody wants. And this is definitely good for us because you get more self-esteem, everything.
What about the recovery after having one of these procedures? Is it very long, painful?
It depends. Like we have like a small liposuction, maybe the recovery is early, just a few days. You have to wear the compression garment, but like it's not that much of pain. But we have sometimes also really big surgeries. Sometimes we have like 5-hour all over body contouring surgeries, these mummy makeovers, where we like repair the muscles of the abdomen, we remodel the breast with implants. And these are surgeries that take many, many hours. And then the recovery is much longer. And also here, it's always good to be like close to your doctor, because also in the recovery, you should talk to the specialist that did the surgery if you need something afterwards.
Surely you have to learn to say no to some of your patients, because you're saying before, this is not a procedure to lose weight. Yeah. There's different things to lose weight. Yeah. And some people, maybe they come and they say, I want to make me into a thin person. So it's not exactly what we're talking about.
No, that's the biggest myth in liposuction, because, you know, for sure, if you remove something from the body, you may weigh less. Yeah. But, you know, if your weight is too high, you have to find some other ways. There are medications. If you cannot reach it only with sport and nutrition, there are really specialists that can help you with this. We can just manage like something that is not in proportion, or if the skin is too loose after this. I see a lot of patients nowadays who are not like massive weight loss, like 15 years ago, after having a bypass of the stomach or something, where they lose like 70, 80 kilograms, and they needed big surgeries. Now I have a lot of patients with Ozempic, Wegovy, they lost 10, 15 kilograms, and they come to me for a liposuction, but I tell them, you know, you already lost weight, so your skin envelope, everything is not that firm. If I remove the rest of the fat, you will have sagging skin. So then I try to deliver with my energy-based devices, some scarless body contouring surgeries. But if there is too much excess, we still have to make a decision.
So in some cases, you have to say no, come back in 10 months, 2 years or whatever, because this is not the right procedure for you.
Exactly. If you're overweight, there are certain things like the risks are higher through the surgery, through the anesthesia. Your result will not look that good. You know, if someone has still too much fat, especially when they have fat around their inner organs, the visceral fat, you cannot really reshape these persons. And I tell these patients, you know, you will invest a lot of money, you will have pain, you will not get a good result, and you anyway have to lose weight before. So first of all, you have to lose the weight, and then we can really help you to reshape you.
What's the most challenging procedures that you do in your field of expertise?
I would say patients after really massive weight loss, like where their weight was like 150 kilograms and then they have 65 kilograms. You know, these poor people, they are happy that they lost the weight. Yeah. But if you see their faces, they look normal. But when they want to go to the beach or anywhere, they have sagging skin. They are really unhappy, and there is no way they can get rid of this. So only surgery can help them. And then sometimes, because it's so much, you have to divide it in several surgeries, and you need scars and everything. But we have a lot of patients, or even scientific analysis, that patients are much, much more satisfied after the surgeries because, if you weigh 5 kilograms too much, it's easier to lose this and cheaper and better. But if your proportions are not right or anything, then maybe really only the plastic surgeon can help you to get these ideal proportions.
Yeah, because in this case, you were saying only surgery can help you.
Exactly.
There's nothing. In other cases, you can go into surgery, you can go, spend 3 years in the gym, really getting pumped up. Yeah. But in this case, the only solution is surgical.
Definitely, yeah. And this is the thing in body contouring that's different than in other aesthetic plastical procedures. Like, for example, if somebody has a big nose and wants to have a smaller nose, that the proportion of the face are ideal, if he loses 5 or 10 kilograms or gains it, the nose will look the same. But my patient, after a very good liposuction or anything, if they gain weight, they will not have a good result. They will not be happy. And they may complain with a surgeon. So I have to educate them somehow that losing weight and the liposuction are really two different things. But as I told you, a lot of patients get very motivated when we talk honestly to them and they see some results after a surgery, and sometimes they're even more motivated to keep these results.
Last question, what's coming in the future in your field? What are the things that excite you the most?
I would say I'm a big fan of new technologies. And I don't think that we surgeons should be afraid that we never have to do a surgery and robots are coming and everything. You still, especially in plastic aesthetic surgery, it's a very personal thing. You have to have a good communication with your practitioner that you have. But still, I think that energy-based devices that help us to do minimal invasive surgery, that we don't need these big scars anymore, I think this already started and this is the future. And maybe also during our consult or anything, maybe also artificial intelligence will sometime help us more to help the patient to predict how it will look like or what happens if he gains or loses some weight. So I think this is the next big future project for us.
We're looking forward to it. Doctor, thank you very much. It was a pleasure.
Thank you.
Thanks.